Hello and welcome to Careers Unlocked, the silent cost of mental health in the workforce. My name is Kiara Ragoni and I'm a Future Students faculty partner here at UNSW Sydney. Tonight, we're going to explore the role of mental health in the workplace, as well as the impacts and opportunities this sets for not only organisational leaders, but the sector more broadly. Before we begin, I would like to acknowledge the Gadigal people of the Aurora Nation, the traditional custodians of this land, and pay my respects to elders past, present and emerging, and extend that respect to any Aboriginal or Torres Strait Islanders who may be joining us tonight. Now let me introduce our expert panellists. Firstly, Julie Dixon. Julie is the Interim Director, Priority Programs Mental Health Branch at New South Wales Ministry of Health. Julie has 20 years senior executive experience across a variety of roles, including public and population health, community health, statewide mental health, strategy and clinical service planning, community and consumer partnerships, as well as managing AOD, HIV and sexual health services. In her role, Julie oversees and provides strategic guidance on publicly funded suicide prevention and peer workforce-related programs and initiatives. Julie is also currently leading the development of a whole government suicide prevention legislation. Welcome, Julie.
Thank you.
Next on our panel is Lee Knight. Lee is a UNSW Academic Program Director for the new Mental Health Practice Program and also a Senior Lecturer in Forensic Mental Health. Lee is formerly trained clinical nurse consultant who specialises in the field of forensic psychiatry. He has over 20 years of experience in the field, including a significant role as the clinical coordinator of a large randomised control study at UNSW from 2013 to 2023. Additionally, Lee holds leadership positions such as a Board of Director and Chair of the Clinical Governance and Operations Committee for the Australian Kookaburra Kids Foundation. Welcome, Lee.
Hi.
And our last panellist is Natasha Davis. Natasha is the founder, director and clinical psychologist at WISE Institute. Natasha is a clinical psychologist with over 20 years' experience delivering evidence-based services to individuals and organisations. A fellow of the Australian Association for Cognitive and Behaviour Therapy, she held many leadership roles in the organisation from 2003 to 2012 and played a pivotal role in the nationalisation during those years. Natasha lectures postgraduate clinical and forensic master's students at UNSW and leads a team of clinical psychologists at WISE Institute. Welcome, Natasha.
Thank you.
And thank you all three of you. Let's get started on our questions. Lee, I'm going to start with you. So in your experience and on a more broad perspective, how are we seeing mental health change on an industry level?
Yeah, thanks, Kiara. Great to go first as well, thank you. Yes, I think the change that I'm seeing is it being more embedded in the workplace and becoming front and foremost. So legislative changes where psychosocial risk and psychosocial hazards are actually legislated to make sure that employers are taking responsibility, accountability and ensuring that those risks are managed and mitigated. So I think we're seeing more and more initiatives and movement towards embedding mental health and wellbeing initiatives in the workplace. I think that's kind of where I'm seeing the change at the moment.
Nice. A nice introduction, thank you. Julie, for you next. There has been a lot of changes in organisations' responsibility to manage the psychosocial risks within the workplace. So what does that mean for Australian leaders, do you think?
Well, I think as Lee just mentioned, the regulation changes, which include the codes of practice for managing psychosocial hazards in the workplace through Safe Work New South Wales and Australia, means that leaders are now accountable and responsible for managing a healthy workplace. And for being proactive, as Lee was just mentioning as well. And the consequences of that too are for employees, which are able, if the leaders are very proactive in that space, to actually feel more comfortable speaking up and speaking out when their mental health is impacted by workplace. And psychosocial hazards include work design, includes the workplace factor and the human factor. So workplace design, which might not be clear roles, clear expectations, to human factor being bullying and harassment in the workplace. And so there's some of the psychosocial hazards that can be displayed, yeah.
Thanks, Julie. And I think it's important to, as you said, raise and highlight some of those psychosocial risks for our audience to explain what they're seeing, because many of us experience them in the workplace. So Data from the Black Dog Institute shows that mentally unhealthy workplaces cost the Australian economy $39 billion annually. That's a very staggering and alarming figure. Natasha, as a clinical psychologist, what are some of the key drivers attributing to this figure?
It's a huge figure, isn't it? I mean, a couple of the factors that come to mind there are absenteeism as well as lost productivity. But if we dive into what's going on in mentally unhealthy workplaces, I think we can get a bit more of an understanding. So things like workload pressures, the ability of them to be able to fulfil the demands that are required of them, the complexity of work. So across all industry, people are reporting that the complexity of their work has increased. In addition to that, we've also got an increase in casualisation of the workforce as well as the gig economy. So people aren't getting those entitlements to take time off, to look after themselves, to take leave as they need it. So taken together, there's a lot more stress that workers are experiencing, a lot more worry, and also just not understanding whether their role's going to continue. So a lot of job uncertainty is also leading to increased worry, stress, and also their well-being decreases with that.
Thank you. So Lee, as a clinical nurse consultant, you are often in the front line in providing critical support to employers returning to the workforce after taking some time away for mental health purposes. So what are some of the biggest disconnects that you can see when it comes to organisations managing mental health in the workplace?
Yeah, thanks, Kiara. It's a very important and interesting question. So I think often when somebody returns to the workplace after a period of leave for mental health or wellbeing issues, there's often a fear of how they might be judged or that fear of stigma from their colleagues. So that can add to the complexity of the person going back to the workplace. I also think there's often people will return on light duties or different duties to what they have been engaging in. And I think if they're not managed appropriately or correctly, and I think there can be a fear of perhaps giving someone too much responsibility, and that comes maybe at the expense of giving them what they might see as less meaningful duties. It can create that disconnect between the employee and the employer, where there can be a bit of tension between, I guess, the employee feeling that there's not good intention in the return to work plan and all of the challenges around that. So a lot of the work that I do with people who come to see me is about moving through their return to work plan, if that's in place, and making sure that incrementally they are able to return to their pre-injury duties, but doing that safely and appropriately, and also just helping them manage the complexities of returning to work. And for my clinical practice, things that really kind of mess up that process are things like pay. Sometimes employers get the pay wrong because it's changing over from one kind of scheme to another, and that can really be a destabilising influence on someone's return to work plan. That's kind of what I'm seeing.
Thanks, Lee. Back to some more of that, I guess, alarming data from that Beyond Blue research. It revealed that for every $1 spent on mental health strategies, businesses actually see a $2.30 return, which is great. So, Natasha, what kind of mental health strategies can everyday businesses invest in that they may not be aware of?
It's an interesting topic at this time because I received in my inbox an email from New South Wales government, an initiative that they're rolling out with mental health programs, that they're literacy programs for managers as well as for employees. So the timing is quite good. So certainly that'd be one of them. So resourcing your staff with mental health literacy programs. These are free programs. As I said, New South Wales government, you can get it on Service New South Wales, I think, is one of those avenues. And that will help your workforce to understand and be able to recognise some of those early warning signs of someone who may not be doing so well. Also resourcing employees with knowing them as well so that they can be more proactive in their response. In addition to that, there's a lot of apps that are available, so mental health apps that are freely available. I can run through a few of those, but some of them that are very popular are things like Smiling Minds. We also have Headgear, which is a Black Dog initiative, which provides behavioural activation strategies and mindfulness strategies. These are all evidence-based strategies that people can access for free. In addition to some of the other well-known ones like Headspace. There's also one called Mood Gym, as well. So all of these are accessible for businesses to be able to use and incorporate in their workforce. In addition to that, I think some of the initiatives can be just starting to raise the conversation, starting to reduce the stigma around mental health problems by starting to talk with workers about how they're going. Certainly, you can put it more formally, like starting to track mental health outcomes in your staff. There's some measures that we've used in our organisation called the Warwick-Edinburgh Scale, and it's one that we distributed to our staff on a regular basis so they could do a self-check-in, and then we would collate that and see how the group were going over a period of time. So this is one of the things that organisations can do, is start to incorporate these mental health outcomes as one of their KPIs in their organisation, making it a focus for everyone. Yeah, a few ideas anyway.
Yeah. Great, thanks Natasha. As you said, there are a lot of resources available out there. It's just really onerous on the organisation to feed that information down to their employers so they know what's available and aware for them. Because as the statistics show, money is well spent and the return on investment on employers is really evident there.
One of the things I find is people knowing where to go to find these resources, so that it can be quite overwhelming. So one of the kind of questions I often get asked is, where are the apps? Where is the websites? Where is there one centralised place to go? And I think that's really quite difficult. So finding that one-stop shop to get all of the kind of resources that you need is really challenging.
Yeah, easy in large organisations with very well-developed staff intranet sites, but for smaller businesses, you know, it can be quite expensive to set up something like that. But you know, even just having those informal conversations and knowing that those resources are available to feed your employees to the right direction. Thank you. Lee, a question for you now. Only 37% of employees believe that their leaders are supporting mental health in the workforce. So how are we seeing this translate in the workplace?
Yes, I think the statistic I read was 71% of leaders think that they're doing it well, and only 37% of employees think that they are. So I think that is an absolute disconnect. That if you think you're doing something well, but the way it's being received is not commensurate with that is a real problem. I think often good intentions can be misinterpreted, or they can also just fall short of what the person's expecting. I think often, in my experiences, it's quite piecemeal, mental health and wellbeing in the workplace. I find that it's, you know, little bits here, little bits there, rather than being embedded in the culture and rather than seeming a priority. It's almost seen perhaps as an afterthought, or at least these just like little pockets of things. So I think embedding it in the culture, I really like the idea of KPIs around mental health and wellbeing. That's really good. But really, I guess speaking the speak and walking the walk as well as an employer is by modelling behaviours and modelling initiatives and modelling ways of improving mental health and wellbeing in the workplace is really, really important. I think I will say as well, what I kind of hear is often the responsibility is being placed on our leaders to develop this and to bring it to the workplace. And I think that is really, really important. But I often think that sometimes leaders are forgot in their own mental health and wellbeing and kind of expected to have good mental health and wellbeing just as a matter of course. So I think there really is an education piece around that, so that the leaders in organisations can model that good wellbeing, that good mental health structure, and bring that back to the workplace. So I think it is about embedding it rather than having it fragmented and piecemealed.
Yeah, that's right, in all aspects of the organisational structure. Yeah,
I think it's also, to that point too, about providing the opportunity for training and education for the leaders as well, particularly those that might be more transactional in nature, because this really calls for the human factor in leadership to come through really clearly with these changes, particularly around managing and identifying and managing psychosocial hazards in the workplace. So I think equipping with the leaders, because I think sometimes people go into leadership positions and it's they might be intuitively a good leader, but you actually need the skills and capabilities to actually manage staff well. And we know that most people leave their role because of their manager. It's still the case. So, you know, I think emphasising for making sure people are trained sufficiently. And that requires a really deep understanding of what mental health and wellbeing is. And it doesn't look the same for everybody. So that's the other mistake that can be made, is it's not a one-size-fits-all for the workforce too.
Yeah, good point. Thanks, Julie. I'll stay with you now. So what are some of the key trends we are seeing across Australian workplaces around the evolution of mental health practices? Opportunity for you to add some points there on peer workforce space.
Yes, yeah. Well, the peer workspace is really interesting. So, I mean, in health, in New South Wales Health and across the local health districts and specialty networks, there's a really growing recognition of the value of the peer workforce, people that have the living experience of mental health issues. And I think, the other thing coming forward here is that we know post the COVID pandemic that young people who are in the workforce can have higher levels of psychological distress as well. And so it's really of critical importance to support the whole workforce across the age span, but particularly focusing on young people and making sure that people with living experience have the necessary supports as well. But the other thing is that the workforce are doing is really opening up that conversation about mental health, and that in turn is reducing the stigma associated with it. The other really important sort of, I think, emerging practices is peer support programs. And these can be people who are trained to support their colleagues in the workforce as well. I think, it's fair to say that often we'll go to trusted colleagues to talk about things more than necessarily clinicians sometimes. And so I think there is growing evidence of the value add of the peer support programs. The other area, just touching on leadership again, in the human, sort of really focused on that human factor of leadership, is the importance that leaders who display compassion, not just empathy, but a drive to action to support their employees, acts of kindness, generosity, and being authentic and vulnerable. We all come to work normally to try and be the best of ourselves, and sometimes we make mistakes and sometimes we don't have such a great day, but creating those psychologically safe environments where you might and have a different view to your leader and being able to open up and have that view is really critically important in the workplace. As is consulting. We talked about consulting with your employees, because for one team, a mentally health workplace might look different to another team. And we're all individuals, and we bring in our diverse experiences, our diverse skills as well. And so you've got to tap in and get to know your employees, find out what the stresses are in a workplace, what the workloads are, and really tap in. And that really, you do need to display really high levels of compassion. The transactional leader is out the door and the human leader is in the door, and I think that's really, really important here. And it goes upwards to the board as well. Your point, Natasha, around KPIs being built in everyday business and tapping in and finding out, from the board down, how are your employees travelling? Because, that shows the employee that you value them as well, and that's equally important too. Yeah.
Just on that point, Julie, I know that in some workplaces doing a team charter where the team themselves define what behaviours they want to see from each other and what they're going to do if they notice that there's any lapse of that. So the team themselves are coming up with that to define what they would like as their culture.
Yeah. Thank you. Lee, I'd be interested just for some of your experience from an industry level. What are the key opportunities for individuals to improve the mental well-being of their workplace?
Yeah, so I think I really like the peer support idea. I think that's really good, and I think often employees will want to talk to other employees, maybe out of fear of potential ramifications from speaking to supervisors, whether real or perceived. But I think again, it comes down to that embedding it into the culture of the organisation and making mental health making workplaces safe and making them psychologically safe. I really think leaders being vulnerable and being kind and giving that opportunity, I think that's really important as well, because it leads to more engagement in that kind of behaviour. I think I also like not always being about work, so maybe having some social or other activities. So I remember during COVID really I'm a really sociable person, so my wife loved COVID because she doesn't like going out and mingling with people, but I found it really challenging and really stressful. And I found my day was going more to just being meeting after meeting after meeting, and I really enjoyed some social activities, like even just doing a quiz or just playing a silly game or telling yourself about each other. So I think those kind of things are really important, and just keep talking and keeping the conversation going, because we do need to. There's still some work to be done, which really baffles me because I work in the industry, is the stigma and people not wanting to speak about mental health or wellbeing issues. And I find that really challenging, because we should be talking about it like any other illness or any other condition or
100%.
any other.
Yeah.
Absolutely. So yeah, I think those conversations doesn't always need to be so serious as well. So, some enjoyable activities. And I also think maybe education, so passive or different kinds of nuanced education about mental health and well-being, so that employers actually can learn more and embed it more into the culture. So that's kind of my thoughts.
Yeah. Natasha, further on that again, what do you think the expansion of the mental health practices mean from an industry perspective?
Yeah, I think it's just that increase in responsibility taking by industry leaders for the mental health of their workforce. I mean, as you were saying, it is no different to physical health. Just as we work out the ergonomics of a workstation when someone starts, there should be the capacity to have those open conversations to understand what someone needs to perform at their best in a role. So certainly having more of an openness, understanding, responsibility, like we've been talking about. But it also means that it's changed. Now that we have, these figures about the economic improvements that come from these programs that are running, we also have now an economic imperative for organisations to take it on board. So I think across the board, I'm delighted to see these changes, and I'm particularly delighted to see that there is now an imperative that organisations are looking at this, because the stigma that has been around mental health has really stopped for these conversations to occur, and for workers to be supported in the way they need to.
Yeah. Thanks, Natasha. Lee, we've brought up quite a few times tonight the psychosocial risks of mental health and how businesses are starting to manage these. Does this have a flow-on effect to minimise the weight of mental health on the healthcare sector? And are you seeing the introduction of mental health focused roles in organisations?
Yeah, so I am seeing. So I'm in my role as a director of the Australian Kookaburra Kids Foundation. We're really, that is a mental health charity, so we're really embedding mental health and wellbeing into that culture, and specific roles. So specific roles that I've heard of and seen are mental health specific HR roles, mental health and wellbeing. Officers, I guess they always put the word officer on the end of a title. I've never understood why. But yeah, mental health and wellbeing being embedded in the workplace. And I think just to kind of follow on from that is, I think it's going to get to a point where if you are an employer who is not engaging in these initiatives or embedding mental health and wellbeing into your culture, you're actually going to be left behind, and you're not going to be seen as an organisation that people want to work for. So I think it is really important that these roles are identified and embedded, but I think they've got to be meaningful and really well thought out and implemented well, and also the reason for it explained to the staff, and all of those things, because the last thing you want is to kind of feel like it's a tokenistic approach. So I think that embedding it into the culture, into the workplace, and also letting everyone know what it's for, why it's important, and encouraging use of it as well. That's the other thing. So
yeah. Nice. So Julie, I just had a question for you. We've been talking a lot about a mentally unhealthy or toxic workplace, but I think it's great for our audience to see, what does a mentally safe workplace look like?
It's a good question, isn't it? I think it can mean different things to different people, but ultimately it really is about a workplace that protects and promotes the mental health and well-being of its employees. As I think we've been talking about, that goes all the way down through the organisation, from the governance of the leadership at the top to the managers, and across all levels of an organisation. And I think, Lee, I like that sort of point you made, that I often think a mentally healthy workplace is one where people feel connected and they actually have some fun. Laughter is a really important thing at work, and being able to socialise if people want to. It's not for everybody, but it's really tuning in again to the employees. So for somebody that's travelling 2.5 hours each way and back, so 2 to 4 hours a day, which some of my employees have, and if you're not a frontline worker and you can actually work from home, then I think increasingly recognise, the organisations realise that employee you're not going to get the best out of that employee as well. So I think a mentally healthy workplace where possible, flexible work practice, and better to switch off. We talk about, we're on the email all the time, but actually, regulations now indicate that employees can and should be switching off at a certain time. Certainly in France, other European countries, they certainly make that very, very clear. And I know in my own experience with my managers who've clocked off themselves, it's really freed me to clock off as well. So I think both Natasha and Lee mentioned about leadership at the top. It's about that role modelling. It's about not being tokenistic. And again, it comes back to leaders being caring, compassionate, kind, authentic. I think they're so critically important, because employees can spot their managers if they're not being genuine, and as soon as that comes through, you lose the credibility. Yeah. So those are the sorts of things in a mentally healthy workplace that you have. And the last one is about that we've been saying is around embedding it on an everyday business, day-to-day business, and providing those supports available is of critical, I think, within the workplace too.
Yeah, she said it's very hard to do something if you can't see it happening in front of you. So,
I just wanted to pick up on something that you said there, Julie, which I think is really important. And it's about choice. It's about giving people choices of what they're participating in and what they're not participating in. So an example might be you might have the idea as a leader that you're wanting to implement yoga at lunchtime or mindfulness at lunchtime. But for some people, what they need to do is to not be around people at that time. They just need to, as we're saying, disconnect, maybe go for a walk or so forth. So I think it is about, as you've said, as a leader, starting with speaking to your people, understanding what they want, and give people choices about what they opt into and what they don't.
Natasha, you've reminded me, I think there's an increasing recognition of people who are neurodiverse in the workplace. And as you just point out, that particularly for people who are neurodiverse, they might require different sort of aspects of their role where they might just need to tune out, or they might need complete quietness because they needed that to actually better focus on the task. So, I think that recognition of 1 in 6 people have experienced mental ill health in their lifetime. In our adult life, we spend 1/3 of the time at work. So, we bring the whole person to work, don't we? And so, recognising that whole person in the workplace is really important as well. Yeah.
Thank you. To finish off, one of those blue sky questions, and Lee, I'll continue with you. I'm keen to get your takes on the future of mental health in the workplace more broadly.
Yeah, I'm really excited about AI, which is kind of an unusual place to think about with mental health. But in my own practice, I'm using AI note taking in order to write my clinical notes. So that's a progression that frees up clinicians in order to concentrate more fully on the session. I think I didn't fully answer your question about the workplaces looking after mental health and well-being, so apologies about that. If someone is feeling like they're under a huge amount of stress and have got a significant amount of cognitive overload, then that might carry on into their own personal life, and that may well result in them needing to get some professional mental health treatment. And I would certainly advocate for that, because I think early intervention of professional mental health treatment is really important. So I would much rather see someone go and see a clinician and, arguably not need to, but in order to get that early intervention and those strategies in place. But I think by having mentally health workplaces, we can reduce the burden on the mental health system. So if people feel supported and they're able to process and perhaps reduce their level of cognitive overload in the workplace, then we might see a flow-on effect to the public and private sector, which there are huge waiting lists in the private sector, particularly. Like, I think it's between 6 to 18 months to see a psychiatrist, at least 6 to 12 months to see another mental health professional. So the waiting lists are huge. But coming back to kind of like my AI mental health dream, kind of seeing it looking at kind of not predictive insofar as predicting on an individual level, but businesses being able to use maybe staff pulse surveys to predict potential at-risk groups of staff or potential at-risk times of year even, depending on the industry. So I think AI and kind of like that machine learning and group statistics, I think we're going to see a big move in that. And I think it is worth investing in.
Yeah, absolutely. Yeah. Thanks, Lee. Natasha, anything else you wanted to add to the future of mental health in the workplace?
No, I'm very excited by Lee's vision there. I think I'm also excited by the fact that business owners are taking up these training programs. I think the more that we can educate our leaders, as we've spoken of today, and managers, the more that's going to flow down into the workforce. I'd like to see it as open, like I mentioned before, open and supportive as we do around physical health. You know, if someone injures their back, you know, moving house on the weekend and comes back to work, and there's conversations about needing to be at a standing desk for a few weeks or something like that, I'd really like for us to be able to have those sorts of conversations when it comes to having a hard time, feeling depressed, or having heightened anxiety or stress at home, and, you know, making those immediate adjustments in the workplace so that we don't have this chronic situation evolving where people feel more isolated and alone, even though they're in a space where they can be receiving some help.
Yeah, exactly. Removing that stigma, right? Yeah. And anything that we'd like to add, Julie?
Well, I know that the psychological injuries have been increasing, and my understanding is the three biggest factors are workload, harassment and bullying in the workplace. Now, some of that could be brought about through more awareness and education, and we've been talking about opening up the conversations. But if I had a wand, I would love for those experiences not to be had on employees. So again, it requires the leader to be, as you said, to be role modelling, to check in on their employees, to know how they're travelling, and also for the organisation's governance to actually be aware of this as well. So I think, you know, that's really important from the workload, and looking at things which I know post-COVID, where it's appropriate, we are allowing more flexible work practice, which I think is really helpful in reducing burnout and presenteeism as well. But the bullying harassment concerns me still, that they are the two big other reasons. And knowing that the leadership, you know, all the way through the levels of the organisation is accountable. We've really got to unpack that a bit more and find out, because, you know, at the end of the day, we should never tolerate toxic behaviour. So I'd love to see, if I had a wand, to see that not occurring. You know, that does play out, and people go, you know, work cover, and we know that psychological injuries can take longer to recover from, so to get that point. So, you know, there is more to do in thinking about and equipping leaders, and also making them more accountable for their behaviour. I think I'd love to see that more into the future focused on as well. Yeah.
Great. Thank you, and thank you to our three panellists. A very thought-provoking way to finish our formal questions tonight. As we've been sitting here, our audience has been adding some questions to the live chat, and I'd like to approach some of those if we can. So I'll get started. Julie, this is a good one. Changing workplace culture is a challenge, as we've all heard about tonight. So what advice can you give to help introduce and implement mental health programs and strategies in organisations?
So I think one of the key factors in introducing it is to find out about your employees and to find out and truly connect with them and engage with them, because by doing that you're going to have a better understanding about what their mental health needs might be, and to consult with them and take in Tasha's point around whether it's surveys, assessments and things, and then getting their buy-in and saying, look, this is what, you know, the current levels of mental healthy workplace are, what do you think are some of the things that we can do to better support you? So I think if you're going to be introducing that, it's really important. But as Lee said, it can't be tokenistic. It has to be something that's built in on an everyday basis, having those conversations, having those programs, whether they're digital or face-to-face, having a variety of different sorts of mechanisms to support people, and the supports are there as well. And as you said earlier, it's making sure your employees know what is available actually as well. Service New South Wales does have a whole range of resources online, whether it's the Black Dog Institute, Safe Work Australia, Safe Work New South Wales, and Beyond Blue. So there are a lot of resources there that if your organisation can't always support you in delivering those, then you can actually tap in to the digital resources that are available too. And I think, both Lee and Natasha have mentioned about the culture of the workplace. It's not something that you can change overnight, but it's a multifaceted approach, and goes from the work design to the organisation's policies in place, to, as you mentioned, having some fun, engaging, feeling connected, and feeling that work is meaningful and that you're valued. All these things are really important, but they can't happen overnight. It does take time, I think, and it has to be sustainable as well.
Yeah, getting that good energy and dopamine flowing.
Exactly.
I just wanted to add to the resources. There's so many available that I think when someone's stressed and overwhelmed in the workplace, actually choosing which one, it can be a huge problem. So I hear time and time again that people aren't helping themselves, when in actual fact the actual sheer amount of information is so overwhelming.
Yeah.
So I think it really speaks to simple, easy to access. Like even when I've been to websites where there's a list of resources, it often directs you to another site, and if I'm 3 clicks away from giving in and everything. So imagine having to go to a site, find the information. So I think businesses could really benefit from investing in a simple place, but also a resource where you can almost type in what you're experiencing and where do you go for assistance, and trying to make it a one-click rather than a search. That would be
spot on.
my thing.
It's like the health system wayfinding.
That's
it's
it.
very difficult.
You need a map to find where you're going.
Actually, Lee, there's another good question here from the audience around just saying there's obviously a lot of information overload on the resources that are available, but what advice do you have for leading teams that are having to navigate the constantly evolving and highly sensitive changes in the landscape?
Yeah, look, I think it's important to keep abreast of all of the kind of current issues and trends and that are emerging in this area. So absolutely, I think it's understanding what's going on in society, and at that time, like there's often different cultures and different groups who are experiencing different kinds of challenges and different issues. So it's keeping abreast of those, but also you need to be obviously on top of the legislative frameworks under which we work. Not knowing legislation is not an excuse for not complying with legislation. So it is incumbent upon employers to know the legislation. I also think making sure that you know, again, I'm going back to kind of tech, and I'm no techie, I don't know how to do it, but I think keeping the technology and the systems updated so that they're easy to use, they're user-friendly, and people can find the resources that they need readily and easily. And again, I know I keep harping on about it, but it is that embedding it in the culture. I think that's the most important thing that we can do, is just make it as normal, which it should be, as physical health, as normal as knowing the process for taking leave, as easy as knowing how to, book a room. That should be embedded in the culture of organisations, I think.
Yeah. Actually, Natasha, on that technology space, there's been a lot of discussion in the media around the negative impacts of technology on mental health in the workplace, particularly around the diminishing ability for employees to disconnect. We've seen that new legislation come in. I'm interested to get your thoughts on the opportunities technology presents in terms of better managing mental health in the workplace.
Yeah, I guess when we're talking about controllability over your work and so forth, certainly technology allows us to have flexibility. It allows us to be able to use it, like you were talking about. AI is a good example of that. Getting technology to enhance our work and take off some of that cognitive load, which you've heard us talking about. I know both Lee's in particular have been talking about that. In addition to that, we've also got the rise of telehealth services. You know, it certainly was not just during COVID, it's continued since there. We've also got online mental health services now that people can use. We've talked about the apps, so there's a lot of apps that people can use to not only learn about what they need to be doing for themselves, but also to track their own mood or like I said before, there's some fantastic programs there where they're running full programs online. In fact, we've actually picked that up ourselves at our clinic. We've got whole programs run online. So these are some of the ways that technology is supporting. And I think also you've got the access to real-time support. So you've got other co-workers or managers who you can now have more contact with because you can use Teams and various other virtual services to do that as well. So I think, you know, there's pros and cons from it. There's also clinics called pop-up clinics, which either come into the workplace or are outside of the workplace. So there's some really nice initiatives that have been taken up to enhance people's mental health using technology and some of these other services.
Yeah.
I think on that as well, it's quite important to have, and this is what I found, working in forensic mental health, a bit of a separation from the mental health services and corrections, I guess, is what I think of in that space, but also in the workplace is a separation between things like the pop-up clinic and the workplace so that employees know that it's confidential, it won't go against them in the workplace. I think that's a really important thing, and that needs to be spoken about because I'm often surprised at how people presume that you can just talk about their mental health and just pass that information on without their consent. So I think knowing that there's a separation between what you tell the person you're speaking to about your mental health and well-being in the workplace, I think that's really important.
Absolutely, for psychological safety.
Absolutely, yeah.
So we've got another great question here from the audience, and we've been speaking a lot about the managerial level or higher levels up in that directorial space, but Natasha, what if you're not in a managerial position? How would you recommend people champion safe mental health practices?
Yeah, this is picking up on some of the things we've been talking about in terms of peer support. So thinking of it more broadly, you know, in general industry, you can certainly equip yourself with some of these training programs that I was talking about before in terms of understanding mental health literacy, understanding how to recognise signs of someone struggling, a co-worker struggling. Certainly starting to champion in your organisation a movement towards trying to embed some of these things in the culture, like you was talking about, Lee, and Julie as well. So coming from that position, really taking the initiative of speaking up where you can and have an opportunity to suggest that the organisation take certain initiatives on board. Also walking the talk, so you yourself also, you know, clocking off and how much that then affects your co-workers and supports them to do the same. Also, in terms of peer support, having conversations with your co-workers about how they're going. I do think this is important. It's also important for it to be limited to within what would be something that they would be discussing with other friends, and knowing also about the professional services that are available, or as I've said before, about apps that are available for them to access if they're needing professional support. And the reason why I say that is that we do know that burnout is something that can be contagious between co-workers. We do know that things like the emotional labour that people experience in their work when they are feeling down and when they're feeling exhausted or maybe a bit cynical and starting to question themselves, and question their capacity to be able to do their job, we do know that it has a flow-on effect to other co-workers. So I think this is why more education and training in this area so people understand when to recognise that in a co-worker so they can provide that limited support but also refer them to other services. But I also mentioned before about team charter. So, you know, asking for your organisation to have a meeting where as a group you answer the question of what sort of behaviours do we want to see from our other co-workers. And those sort of initiatives don't cost money. They are obviously costing time in bringing people together, but you can certainly get behind that one.
I think just from that as well, what was coming into my mind as you was talking was about inclusivity as well. So I think in the workplace, there's a whole heap of different people coming together in one place. My brain was kind of like the LGBTQI plus community and making sure that workplace practices are inclusive, but you as an employee and making sure that that inclusivity is actually real and genuine and that everyone feels included and heard, and also maybe looking at things from another person's perspective and how behaviours and attitudes and even things that are happening in the world at that time might impact your colleagues. I think that's really important. But to promote and model that inclusivity in the workplace, I think is really important and is often forgotten.
Yeah, that's right. Having the ally networks are really important as well, which I know
yeah.
universities have, but other big employers, I know how important they are. And as you said, it helps the people at all levels of the organisation feel that they can go to somebody, whatever level they are, and seek advice or get support for their own issues or other staff issues.
And I think if you do have a psychologically safe environment, which means that employees can speak and provide a different view to someone else or their line manager without fear of retribution, that's of critical importance because that is their right, but it's not always easy to do if you don't have the right culture. But it's really important. But what are the below and above line behaviours? So what are the behaviours that you're going to tolerate through that team charter? But actually, what's really, really important is to hold people accountable. And often we can have this, but we don't actually act on it. And I think, again, you've got to role model that as a leader and say, actually, that behaviour was below the line. I'm going to call it out even to the side individually, or it might be necessary within the team as well to show what is appropriate and what isn't. And that's really important as well. So on a day-to-day basis, you have to sort of put a focus in this, in this space around mental health.
Yeah, absolutely. Thank you. We've got time for one more audience question, Lee, and this is forward thinking.
Wow.
Looking at that educational piece, what we can do to bridge the gap. So someone's asking, what opportunities are there for someone who's interested in the mental health space but doesn't have a medical background?
Yeah, it's a challenging question, but I think there's more and more opportunities as we've discussed tonight opening up. So, mental health and wellbeing specific HR positions, mental health and wellbeing officers, and various other roles like that. So we are seeing different organisations offering different pieces, I guess, of the solution that don't necessarily need a clinical or medical background in order to provide mental health and wellbeing support. So the Australian Kookaburra Kids Foundation, where I'm on the board of directors for, they're a mental health charity who look at what's called pre-early interventions. So children who are impacted by familial mental illness, they're given psychoeducational mental health literacy and help-seeking behaviours. You can be part of that as either a volunteer, so you can go and volunteer your time and be engaged in that. And I'm not doing a promo for them, but I'm just looking at different aspects involved in, helping with even making mental health materials or literature easy to read, and so design and production and all things like that. So there's many different aspects that you can step into. There are peer support workers. There's a whole heap of different industries that you can go into which have got a mental health and wellbeing focus. I think it's keeping your eyes open, seeing what's out there, and looking for those opportunities, and they are definitely out there.
Yeah, you've just raised a good point there around accessibility of those resources available. It's all very well for an organisation to say, yes, we have X, Y, Z, but they need to make sure that that's available for everybody in the workplace. Yeah, very good point, and very good way to finish. Thank you. Unfortunately, this is all we have time for this evening. I want to thank everybody who joined us tonight for investing your time and listening to our expert panel. But I'd really like to thank the three of you for generously sharing your experiences with us. And we hope you have found this session just as useful as well. Thank you. If this event has sparked your interest and you are considering delving a little bit deeper into the mental health, UNSW has a range of programs on offer. We have our new graduate certificate in mental health practice, which will be available from 2025, and it offers flexible online training for health professionals. With focus on interdisciplinary learning, it's guided by leading researchers, Lee over here, and it addresses the growing need for skilled mental health practitioners. For information on this program and more, I encourage you to go online and check out the UNSW Degree Finder. Thank you.